Good morning, Governor, and good morning, everyone. I am Tony Catone, State Director at the South Carolina Department of Social Services. I want to welcome you all here today as we announce South Carolina's participation in the new federal initiative, A Home for Every Child. We're fortunate to have with us today Assistant Secretary Dr. Alex Adams from the Administration of Children and Families and the U.S. Department of Health and Human Services, as well as key leaders from our executive leadership team at the Department of Social Services. Today, we're also joined by several key legislative leaders who understand the importance of not just serving children and families, but serving families in a way that improves outcomes while obtaining family independence and stability, including Senator Tom Young of Aiken County, who serves as the chairman of the Senate Family and Veteran Services Committee, Representative Lee Hewitt of Georgetown County, who serves as the chairman of the Health Care Subcommittee on the House Ways and Means Committee, Senator Jeff Zell of Sumter County, who is a member of the Senate Family and Veteran Services Committee, and our State Superintendent of Education, Ellen Weaver. And I would also like to welcome our many advocates, partners, stakeholders, and providers who are gathered with us today, including members of the Joint Citizens and Legislative Committee on Children, the DSS Advisory Board, as well as leaders in the child neglect and abuse prevention space, like the Children's Trust, as well as leaders from our service community, including the South Carolina Network of Children's Advocacy Centers and the Palmetto Association for Children and Families. Thank you all for being here today. A Home for Every Child is a transformative move by the Administration of Children and Families that will amplify the reforms and changes in how families are served in our state. South Carolina is already moving forward with improvements to our child welfare system, including reductions in entries into care, a strong kin-first placement culture, and we have made significant progress in safety, placement, and permanency, all a part of the metrics in our Michelle H. Federal Settlement Agreement. To date, DSS has met or exceeded about 1/3 of the required metrics as part of that settlement agreement, and thanks to the support of Governor McMaster and the investment from the South Carolina General Assembly, improvements and outcomes continue to advance. But more importantly than metrics and numbers, DSS, along with the child and family serving agencies and programs in this state, see A Home for Every Child as a way to drive the message for the need for stronger prevention services and resources for families so that no child or family falls through the cracks or feels like entering into foster care is the only way for a family to receive the help that they need. Whether that's mental health, disability supports, or providing basic needs for their household, at DSS, we fight hunger, poverty, abuse, and neglect, and we do that by loving our neighbor. In addition to our prevention efforts, the recruitment, training, and retention of foster parents are integral parts of this new initiative. And we welcome individuals and families who feel called to serve as foster parents to step up and learn how you can minister to children and families in your community and provide safety, stability, and support for a child or youth in crisis. Foster parents are our valued partners and kindred spirits in service to this mission, particularly including those that step up to care for members of their own families through kinship care. We need more foster homes in every county so children can be placed in their home communities, closer to their schools, friends, and churches. And if that call is on your heart, you can make a difference in the life of a child by getting started today. And our greatest need for foster parents in South Carolina remains foster family homes that are committed to serving older youth and teenagers, groups of siblings, and medically complex youth. We need so many families in South Carolina that we have families waiting on children rather than children waiting on families. If serving as a foster parent is something that speaks to your heart, please visit heartfeltcalling.org. That's heartfeltcalling.org to learn more about fostering and take the first step in the process. And now it's my honor to welcome Dr. Alex Adams, Assistant Secretary for Family Support at the Administration for Children and Families, to deliver remarks. Secretary Adams, sir.
Well, good morning, everybody. On behalf of the U.S. Department of Health and Human Services and Secretary Robert F. Kennedy, Jr., I'm pleased to have South Carolina join as the 18th state to join a Home for Every Child initiative. This initiative comes from President Trump and First Lady Melania Trump's executive order that they signed last year, Fostering the Future. And it asked us to clear away the regulatory brush, get rid of red tape, and allow states to innovate and allow caseworkers to spend time and energy on things that benefit children and families, not filling out paperwork. Why we launched the Home for Every Child campaign is nationwide we have too few foster parents. If we have 100 kids coming into the system, we only have 57 homes to care for them. We can do better and we must do better. It's not just a math problem. When we don't have enough homes to care for kids, in too many states, those children get placed in non-traditional settings, hotels, Airbnbs, or government office spaces, places that are not conducive to child nurturing and development. So when we launched this campaign, we made a trade with states. We will remove the mountains of paperwork. We will remove pages and pages of reporting requirements and measures that you send to us in exchange for a commitment to get your ratio of homes to kids up. As the director said, if we get our ratio of homes to kids up, we can get to the point where we have homes waiting on kids, not kids waiting on homes. To date, the response has been overwhelming. We're hoping 10 states would join, and as I said, South Carolina is the 18th. It is heavily concentrated in the SEC countries to date. And what makes us excited is when states join, they're going to report to us monthly their ratio of homes to kids. And we think that will unlock competition. Every month, Governor McMaster will get to see how he compares to Mississippi and Alabama and Arkansas. And we think that will unlock creativity, and we think that the competition will drive better outcomes for kids. Usually in events like this, every state pledges they're going to do the best and have the highest ratio. Let me tell you why I think that might be true in South Carolina. They've had years and years of incredible leadership at the top with Governor McMaster and his commitment to improving the lives for vulnerable children, including foster youth. They've had years of great leadership at the agency level. Their commitment to kinship care in particular is notable. And we talked about their percentage of kids placed in kinship and how that continues to grow. I think that's a model for other states. And then just this audience behind us, you cannot solve child welfare problems with the Child Welfare Agency alone. It takes an entire community. It takes the executive branch, the legislative branch, the judicial branch, and most importantly, community-based partners. And I think the crowd behind us today is emblematic of how South Carolina collaborates with community-based partners, in particular the faith-based community. I know that was a hard-fought battle in this state, but one that will help certainly recruit and retain more homes, and most importantly, prevent kids from entering into foster care in the first place. So thrilled to be here, thrilled to be in South Carolina, and without further ado, it's my pleasure to welcome to the stage Governor McMaster.
I want to ask, I'm sitting here trying to remember the name of the movie that starred Orson Welles, where it ended up at the end of the movie, they were trying to figure out what made him tick. As you remember, he was driven, he owned newspapers. I think it was sort of a takeoff on William Randolph Hearst, very powerful. Anybody remember the name of that movie? Who? That's it. Thank you very much. And Citizen Kane. Mr. Kane had all sorts of ambitions, and he stepped on a lot of people on the way up, but he said something at the end of his life, at the beginning of the movie, and then it went back. And they were trying to figure out, going around asking all of his old friends, what drove him, what was the special thing in his life. And it ended up that the word that he barely spoke as he was going to see his maker was Rosebud. And what was Rosebud? Rosebud was the name of the little snow sleigh. And that was the thing that he really loved in his life. Didn't have much of a home life. Most people would say the most important thing, the most important single word, maybe mama, maybe daddy, but always home. And these young people that we are trying to help as much as we can, that is what we want them to have, and that's what we want to be one of the most important words in their lives. So we've been working in our great state, passing laws, taking initiatives. thank the legislature, the leaders in the General Assembly and the agencies for communicating, cooperating, and coordinating, because that's what it takes to get this done. You have to bring everybody together, everyone with their assets and ideas and information. And this that we are doing now, by joining this, I would call it a network, is probably the ultimate communication, collaboration, and cooperation. We have state partners, we have private partners, we have organizations, but having access, quick access to the information, the advice, and the direction that we can, and analyses that we can receive through this department, working with the federal government, Dr. Adams, is extraordinary. One rule that we go by here, when you're trying to fix something or try to do something, you can't manage it unless you can measure it. We do not have here the technology that is necessary, the information accumulated from various sources to where we can measure it adequately enough to properly manage it. We know that. No single state does. But by joining this network, this partnership, grand partnership, that will eliminate red tape. It'll speed up everything because we know what we're doing and how to do it with this agency. So this is a great day for South Carolina. We've taken important steps. One, we've taken care of the children when they get to school. We've raised teacher pay. Doctor, I don't know if you know, we started a few years ago at $30,000 minimum starting salary, $30,100 a year minimum. And with this budget, we're going to go up to $50,500. That's minimum starting pay. And we knew there was concern in the schools for safety. So I think we are the only state in the country that now has about 12,084 schools, I think. Where's the secretary? Where'd she go? She had a meeting to go to, all right. 1,284 schools. We have trained law enforcement officers, trained certified, bearing arms in every school except for somewhat less than 100, and we have the money available for them, but they haven't found the proper officers. So the children are safe, the parents are confident, the teachers are free from those worries, but we got to get these young people to that school, and in order to do that, they have to have a home. So that's what we're doing today. So I want to thank everybody for their participation, support, their time and talent in getting this done. We got a long way to go, but we're getting there faster than anybody else, and thank you.